to jump up and grab something to eat and a cup of coffee as we go through the morning's program. Good morning, everyone.
Good morning.
I'm Mary Ann Garvin, President and CEO of Community Development Corporation of Long Island. Welcome to Home Matters for Health on Long Island. Home Matters is a national movement. We believe that every American should live in a safe, nurturing environment with access to quality education, healthcare, and community services. Home is where we are protected. It's where our health and spirits are restored. It's where we become empowered, encouraged, and inspired. Today, you will learn why a good home is like a vaccine. In our years of working in housing, we at CDCLI have seen the benefits of affordable, good quality, and stable housing on people's health. You will hear more about this when Vaughn Cohen speaks later this morning. We believe that housing is a platform from which we can work to improve health outcomes, particularly when woven into a supportive housing environment that promotes healthy lifestyles. You will hear more about the new signature CDCLI initiative for 2015 and beyond that we are implementing in the village of Hempstead, where too many substandard housing options have resulted in too many unacceptable health outcomes. We intend to build on our early and ongoing initiatives and by what we learned here today, by investing in improvements in the housing stock and also establishing stronger ties with the healthcare industry. Our goal is to achieve positive health outcomes for very low income and very vulnerable people. It is because Home Matters for Health on Long Island that we joined with Hofstra University, Larry Levy, and his team at the National Center for Suburban Studies to present this symposium. I hope that what you experience today will inspire you to get more involved in this movement, and in particular in the cause of healthy homes for all. No one organization acting alone can accomplish what multiple cross-sector collaborations can accomplish together. You are the leaders in these sectors that we are counting on to act, and I am thrilled that you are with us here today. I want to thank our sponsors, JP Chase Foundation, United Way of Long Island, and NeighborWorks America for making this gathering possible. I also want to thank our planning committee for their commitment in working over several months to put this program together. I would ask them to please stand and be recognized. It was really a big investment of time and effort. Don't be shy. Please stand up and be recognized. There were some shy ones who didn't stand up. I'm here to tell you. And finally, I want to thank the presenters today for giving of their time, their energy, and knowledge so that we can all learn and be proactive in making Long Island a healthier place to live. We have a lot of presenters, and rather than spend the time reading long biographies, in your program, there are extensive biographies for everyone. Please take the time to look at them. Very impressive people who we've encouraged to come and share today. It now gives me great pleasure to introduce a man who has made increasing the supply of decent, safe, and affordable housing his life's work, my good friend and colleague, David Walsh.
Thanks, Mary Ann. Good morning, everyone. I am Dave Walsh. I am the Northeast Regional Manager for Community Development Banking at JP Chase. And on behalf of all the employees at JP Chase, I just want to say how delighted I am to be here today to help start the conversation. And it's increasingly becoming more important to talk about healthcare and housing in the mix that we're seeing. We do a lot of work around the globe, actually. and invests billions of dollars every year. It's either investing, lending, or granting to groups that provide safe, secure, and affordable housing. And it's becoming more and more apparent how critical the healthcare component is to helping out the communities we serve. We are highly committed to the approach of financing affordable housing and also increasing the amount of healthcare availabilities in the low-income areas that we serve. That's why I'm excited to announce a $200,000 grant this morning to CDC of Long Island, which will support a pilot program that's going to help rehabilitate weatherized public housing units, identify needed repairs for elderly or disabled homeowners, and track the effect of these improvements have on health outcomes. What we're excited about is this grant is going to enable us to start at a baseline. It's going to enable us to track outcomes and look at the differences it's going to make in people's lives. I think the whole program this morning is going to talk a lot about the different approaches that folks will be taking or will be looking to take as we move forward. And I think we're really excited to hear from all the experts in this arena. So with that, I'm not going to take too long here this morning. It's Monday morning. I know everyone's rushing for the coffee, but we look forward to a very lively conversation surrounding the topic. So thank you very much.
Thank you, David. I'm Larry Levy. I'm the Dean of the National Center for Suburban Studies, and I have 4 quick tasks to do in the 2 minutes allotted me. One is simply to welcome you to Hofstra University on behalf of the administration and the National Center for Suburban Studies, which is a nonpartisan research institute within Hofstra. It's the suburbs from A to Z, from arts to zoology, and certainly with some very long stops in between for health and for housing. The other task I have is to make sure that you understand that while this topic is one that could be talked about in any community anywhere, it is particularly important that we are meeting here in a suburb. Because as some of you know, as maybe many of you know, the suburbs are different than other places. The fragmentation, the isolation, the alienation, the lack of cohesion makes it really important to take a look at issues that we take for granted as urban problems or rural problems or just general problems from the peculiar suburban perspective. I won't go on and give my 45-minute lecture on the challenges of the changing suburbs, but recognize that you are, by virtue of where you live and work and play, are important voices that have to be heard in the suburban perspective, and that's what we're going to look at today. Third task is not on the script, but I wanted to make sure that you all recognize Mary Ann Garvin. Mary Ann is one of those people who runs an agency, a not-for-profit, a big business, but she has become your favorite cliche, whatever you want, driving force, central, pivotal person in driving real change on Long Island. Her role is to do it from the housing perspective, but she has come to understand that it's not just housing alone that matters. Home matters in many other perspectives, and of course today we're going to talk about it in the context of health. I just wanted to make sure that Mary Ann got some recognition. The National Center for Suburban Studies, and hopefully we'll have a role in moving forward. But really, Mary Ann is the person who had the vision and the contacts and really put this thing together, and deserves the recognition. And the fourth task is to introduce another extraordinary individual, Teresa Rignanti, the head of United Way of Long Island. Teresa, again, she runs an agency that a lot of people stereotype, like they stereotype the suburbs, that it just goes around and beats up on businesses to give money every week out of their paychecks. But Teresa also recognized that Long Island is a complicated place, and the challenges are enormous. And United Way, through Teresa's vision, her spirit, her intelligence, has become really one of the leaders for change across a broad front. And she has remade the image of the agency, and by doing that, she has changed many, many conversations on Long Island. So it's my pleasure to introduce Teresa.
That's very nice, thank you. You know, at the top of my list, I certainly had the recognition for CDC as, you know, really an innovative organization that looks at the capacity of what exists and then really expands that. And for Marianne and her team, you know, certainly her staff, it takes a lot of people to move in another direction and to create a new way. So again, to the organization and to the sponsors that really today came forward to have a unique conversation, because you know, housing and health, it's been in our world of the not-for-profit sector. Certainly, we are a little fragmented, coming together a little better today. But when you do have agencies working in a place and space with funders and moving to certain outcomes, and then how those potentially can come together, it does really require a little thought out of the box and say, what do we do to bring these two very vital pieces together? So I want to just say one thing, because I know I have my colleagues in the room too, Rick Wertheim and Craig Flickstein. And Rick's been one of those individuals who has worked in the space of housing for people with AIDS, HIV, and the creation of housing for about 25 years. And we've got maybe about 90 families who we've put in really terrific housing. And the great thing, Marianne, you know, to the health outcomes is tracking with those organizations, those individuals with living with AIDS, HIV, and their health outcomes and their families is a unique space that we've been able to take a look at for over this 25-year span. And people with AIDS, HIV, certainly medication, living longer, and on the housing stock. The United Way is a little boutique housing organization building with the universal design concepts for over 20 years. But now with Department of Energy and their near zero, ready near zero challenge home program, we're about 1% of the builders in the country that build with that concept of the energy efficiency, the durability, all the components, quality built, that you would expect to have in a very low income housing stock model with keeping health outcomes involved in mind. So we're really, as an organization, very excited to bridge to the next level with several others, figure out what as a region we should be doing together, and really interested in hearing the conversation. Certainly we have a lot of experts in the room, and we're just happy to be here to be a part of the next generation of how health and housing will come together throughout Long Island. So thank you, Mary.
So we are a very proud, CDC of Long Island is a very proud member of the NeighborWorks Network, as well as a United Way organization. And Teresa is one of those people who does think outside, you know, what could potentially be a very confined box of thinking what a United Way organization can do. And so bringing together these two, what I almost consider umbrella organizations, to help us bridge and bring together the two sectors was really, really critical. We needed that support. And having the Chase Manhattan Foundation be part of that, JP Morgan Chase Foundation be part of that, representing the private sector. This is what we need to make change happen. And so here we are at Hofstra, and we have actually a facilitator to help us with the dialogue, because we don't want this to be a conference that you come to and leave and nothing results. And when Larry and I first got together and started talking about this, that was the biggest thing that we agreed upon. And so having a facilitator who can help move the dialogue along was critical. And so we have with us today Susan Weinrich, who's the Vice President, Organizational and Community Development for the New York Council of Nonprofits. And she is going to give us an overview of the day and kind of put a framework for us about how we want to think about this day. So please join me in welcoming Susan Weinrich.
Good morning, everyone.
Good morning. Good morning.
What a really inspiring and exciting day this is going to be. We are going to hear from some of the leading thinkers and practitioners at the crossroads of health, housing, and human services. The conference will provide you with the opportunity to listen, to talk, to contribute to this developing practice. Our keynote speaker, Stephanie Ettinger de Cuba, will share her ideas on how a stable, decent, affordable home is like a vaccine, setting the tone for the day and setting the stage for our panelists who will share their research and experiences in putting this concept into practice. They will share their perspectives on how state and federal policy and innovative community practices can strengthen families and improve the health of children, seniors, and everyone in between. After a short break, we will divide into interactive strategy sessions to further discuss these issues. At registration, you were all assigned a group number, 1, 2, or 3. This was done to ensure that we have a mix of expertise in each group. So please go to the group to which you are assigned. So room number 3 is up here, and rooms number 1 and 2 are downstairs. Okay? As you listen to the keynote and panel discussions, think about the issues that will be raised during the strategy sessions. We will move these discussions from the broad to the specific with the following questions, and they're also posted on your table so that you can think about them throughout the sessions. 1, broadly speaking, what types of collaborations across the health and housing sectors will facilitate access to and improvements in health in suburban communities? These are likely to include systems changes, they're likely to include funding, and they're likely to include other types of collaborations across the community, across the region, the state, and the nation. 2, can we begin to identify some specific partnerships that your organization is currently engaged in, and/or can you begin to articulate how partnerships with specific organizations in your community might improve the quality of life and advance practices at the intersection of health and housing? 3, is there any value in keeping this effort going? If so, do you have any suggestions as to how we can continue these discussions at the community level? After the strategy sessions, we will return to this room for a buffet lunch. At 12:30, the session facilitators will share with you the key themes that emerged from all of the strategy sessions. This summary will lead us to the final speaker, Paul Weech, who will help us summarize the key themes of the day and lead us towards a call to action. Before we move forward with the day, I want to let you know that participating in the strategy sessions is not the only way that you can contribute to this growing body of ideas and practice. We have a Twitter feed going, and the hashtag is HealthyHomesLI.
Twitter feeds are popping up right here. We have a note from NeighborWorks, who's glad to be a sponsor. And then the announcement of the Chase Awards build on this important work. So please, if you hear something that inspires you, please share your thoughts on the Twitter feed. If you don't have a Twitter account and want to share a thought or two, please find the old-fashioned index cards that are on the center of all of the tables, write down a note, and put it in the box at the registration table. This information will be fed into a report. After the conference, we will develop a summary that will serve as a resource for future initiatives. Your participation today will help us contribute to the National Home Matters movement
and will serve as a resource for further development of creative partnerships and programs throughout Long Island. Thank you, and enjoy the conference.
Thanks, Susan, very much. So, NeighborWorks has been really a leader in trying to bring the health and housing sectors together. And I was at a conference last year and learned about the good work that was being done up in Boston by the Children's Health Watch. And I was actually blown away because while I have done housing my entire life, and while my daughter is a doctor, I don't consider myself any kind of expert in health, but recognize how important housing is to health. The information that I heard at that conference in DC made me really want to bring this to Long Island, and for all of you to hear this and be inspired to create some programs and make some change happen on Long Island. So we were very, very fortunate that Stephanie Ettinger-DeCuba, who is the Research and Policy Director of Children's Health Watch, agreed to come, spend some time with us, share the research and the data that has come out of really years of working in this field, and help us to better understand why housing is like a vaccine. So Stephanie, please come and welcome Stephanie.
Good morning, everybody. I'm going to apologize ahead of time. I have been getting over a cold, and I'm trying really hard not to hack into the microphone here. This is a quick overview of what I'm going to talk about. How does housing influence child health? We can do an overview of three realms: stability, affordability, and a little bit about quality, and then why it's like a vaccine. So here's your sneak preview. It's like a vaccine because it provides multiple benefits, it has long-lasting benefits and preferential benefits for different populations, and both benefits to individuals and to society. And then I'm going to end with a few examples of how we can bridge housing and healthcare and provide that housing vaccine. So I'm going to present research from lots of different people, but just to give you an understanding of who Children's Health Watch is, we are a nonpartisan network of pediatric and public health researchers. We form a research and policy center, and our mission is to improve the health and development of young children by informing public policies that address and alleviate economic hardships. We study a wide range of issues, but the sort of three key hardships that we're focused on are hunger, otherwise known as food insecurity, unstable housing, housing insecurity, and trouble keeping the heater lights on, also known as energy insecurity. And our goal is really to provide policymakers, experts like yourselves, and others who are leaders, with evidence to develop policies that can protect young children's health and development. We are kind of a hybrid organization in that we collect all of our own data, and we do this in emergency departments and primary care clinics in 5 cities. We're in Boston, Baltimore, Philadelphia, Little Rock, and Minneapolis. We conduct a household survey. We talk to families about a wide range of issues, programs they participate in, the hardships they're experiencing, a lot about their background and demographics. We're interviewing caregivers. They're mainly mothers, but others as well. We're bringing very young children ages 0 to 4 in for care. And there's a couple of really big reasons that we're focused so heavily on this very young age group. One is they're a really invisible group. They're really only seen by their parents or their healthcare providers. Some are in childcare, but a lot aren't. So they really aren't countable and seeable the way that school-age children are. And the second is that this is a really critical window of time in their development. This is the fastest brain and body growth of their entire lifetime. So I just want to give you a quick, to sort of set the stage, a quick tutorial in human brain development. Like I said, this is the most vulnerable period, these early years. This is when synapse formation is happening and neural networks are being formed. Essentially, we're laying down the brain architecture in this period. So those bars that just came up mark that 0 to 3 period. These are the neural connections for different functions, and they develop sequentially. You'll notice that these arcs all peak in those first 3 years. That yellow one is sensory pathways, so hearing and vision. The blue one is language. And the red one near the end there is higher cognitive functions. So all of those things are being formed. Brain architecture is actually the physical structure of the brain. There are interconnections and neural networks. We have about 100 billion cells in our brain, and they're very much, their strength, their ability is very much influenced by lots of outside factors like, thank you very much, sorry, I apologize for happening, stress related to poverty, also housing and food insecurity. And these first 3 years of life, sorry, largely set our trajectory for cognitive and social emotional development, and building on that, school readiness, building on that, academic achievement, and then building on that, educational attainment. So if you don't get it early, it's harder to get to the top. Toxic stress damages brain architecture. Stress is a natural thing. It's a natural response to changes and challenges in our environment. Stress can be mild, standing in front of you today. It can lead to important learning. It can be a good thing for us. Moderate stress can go either way. It sort of depends on the buffering relationships you have around you. Some, a big challenge in your life, but you've got really supportive family and friends. You can learn from it. Or if you don't have that support, it can be a harmful thing. Toxic stress, however, is its own category. It's totally separate and always harmful. Mostly you might have heard about this if you heard about it in the context of neglect and abuse of children. We're learning more and more that economic hardship can fit in this category, that chronic mild to moderate stress, things like food insecurity, like every month of your life that your family's being food insecure and you run out of food at the end of the month. Well, that qualifies as toxic stress, as does acute short-term stress, things like suddenly becoming homeless or death of a parent or something like that. So toxic stress damages the brain architecture of young developing children. So now, connecting to housing, we've always been interested in housing, but a few years ago realized, there's this whole piece of housing that's sort of invisible. They're everything short of outright homelessness. There's a lot of stress happening for families. Published a piece in the American Journal of Public Health looking at housing insecurity, and we defined it as families that were overcrowded, doubled up, or had multiple moves. They were moving twice or more in a year. And we found that kids in those families were likely to be food insecure, and there's a whole host of research looking at how damaging that is to kids' health and development. So their families were struggling to provide enough food. The kids were more likely to be in fair or poor health, be at risk for developmental delays, and be seriously underweight. We hear a lot about obesity, very important problem in this country, especially in children, but in fact in very young children, underweight is as much of an issue, and it's very much linked to undernutrition. So you'll see that come up a few times in my presentation. So why should we care about this? Why should we care about brain development and this housing connection? Well, just to give you the big picture, This is the national unemployment rate. The percentages are up the side and the years are across the bottom. You'll see a spike in all education levels. Those lines are all different education levels. Everybody had a hard time in the recession. Everybody lost jobs. But look at the difference between those that had less than a high school degree and those who had a college degree or higher. You're much more buffered, but how do you get there? You get there because you've got supports earlier on. So, because of this sort of interest in early childhood, we started thinking about, well, does the timing matter? Before you get into the answer, yes, it does. And thinking about homelessness, which is sort of the extreme end of housing issues, we wanted to look at, again, this timing issue, and does it matter when it happens? So we looked at a comparison of 3 groups. We looked at mothers who had been consistently housed before and after pregnancy, the mothers who had been homeless prenatally, and those who had been homeless only postnatally. And we want to understand, is it something about the mothers, or is it the homelessness itself? There's a lot of talk about, oh, it's just these moms are just chaotic and they can't get themselves together, and that's why they're homeless. Or is it actually the homelessness? Well, the answer is it's the homelessness. When you hold constant all these other issues that are characteristics of moms, we found that the connection with poor birth outcomes was only there for prenatal homelessness. So the folks who had been homeless prenatally had kids who had increased risk of low birth weight, preterm delivery, and lower rates of birth. And that sort of led us into this current work with some preliminary data we haven't yet published, looking at the differential effects of homelessness. So if the timing matters, what can we see that's different between the different groups? Prenatal homelessness, again, you see these poor birth outcomes, but we also see that the kids are more likely to be in poor health and be hospitalized. Well, we're talking about healthcare costs, hospitalization, that's a big cost. The average pediatric hospitalization in the U.S. costs between $6,000 and $11,000. So if we can prevent a few hospitalizations, we're preventing a lot of costs. Postnatal homelessness, we found poor child health again, but also developmental risk. These kids were more likely to have developmental delays. And then we really find there's no safe level of homelessness. The cumulative effect also matters. Kids who had been both pre- and postnatally homeless had all of it. They had poor birth outcomes, and were more likely to be hospitalized, be in poor health, and be at risk of developmental delays. So this to me really says we have to think about intervening early. This talks to me about targeting. We'll talk more about that later. So switching gears a little, here's some work we did on affordability. A few years ago, we published a report called Behind Closed Doors, which is exclusively focused on our Boston data. And we've now started to look at all 5 of our sites to try and get a more national look. And it was deliberately named that because this is sort of like the private struggle, right? But homelessness is sort of more identifiable, sort of more out in the public in some ways. Behind, a lot of the struggle of people juggling bills is a private thing, and they haven't sort of manifested in a public way yet. But it has really serious health outcomes. Families who had been behind on rent even just once in the past year had kids who were more likely to be hospitalized, to be in poor health, again, this serious underweight issue. And the moms were in worse health. They were more likely to have poor health or have depressive symptoms. So we know obviously that's terrible for the mothers, but there's lots of research connecting if moms are in poor health, physical or mental, it affects the kids' health as well. And it was really a strong indicator of other household hardships. This again is also preliminary data going across the bottom. The blue bars are those who had not been behind on rent, and the red bars are those who had been behind on rent. And the odds ratios up the side. So we've got very high odds of, if you've been behind on rent, of being household food insecure, of being child food insecure. So this is when the situation is so bad in the household that kids are having to skip meals or not eat for an entire day. Energy insecurity, so their utilities may have been shut off. They might be using a cook stove for heat. That somebody in the household has had to forego health care because they couldn't afford it. And that the child, this young child, has had to forego health care because they couldn't afford it. And this last one, the last bar, is sort of the flip side of that. This is, you've paid for your health care, but that means you've now been unable to pay for food, utilities, or housing. So really serious hardship going on in those households. And then, again, another newer area for us is also looking at evictions. This is actually surprisingly an extremely understudied area. The evictions are forced moves, and they can be formal, ones that reach the court, or they can be informal. And the thing about evictions that's a little different, it can affect people far into the future. It can create difficulty with them obtaining future housing. It can also affect their credit rating if it gets to the court level, which then affects their ability to get a job. So it's something that really follows people in a very insidious way. And Matt Desmond at Harvard has done this, really the main work on this, and in his work he's found that it's about 1 out of every 11 families experiences eviction. They're disproportionately African American, and it has really long-lasting effects. It is connected to ongoing residential mobility, in that there's subsequent unforced moves, so you get evicted and then you probably have to move to some cheaper, poorer quality place, which then you can't stay at, so you keep on moving, even though the moves afterward have not been forced. It's connected to increased material hardship, worse maternal, mental, and physical health, increased parenting stress, worse child health, and it's really persistent. He's found that even 2 years later, he's finding that those who are being evicted are still experiencing these outcomes. And this is our data. This is very preliminary. We found in our data about 4% of our families with young children have been evicted, which doesn't sound like much, but to put it in context, we have about 6% of our families experiencing multiple moves, and those have really horrendous child health implications, and we've actually been looking at it as something that to use clinically as a triage question because it's so bad. So it's important anyhow. About 43% of those evictions were unrecorded, so if we just looked for the courts and tried to figure out how many people had been evicted through it by looking at court records, you'd miss a lot of people. For us, the largest groups who had been evicted were in Baltimore and Philadelphia. And we're starting to see some sign of what the risk factors might be. First one is prior homelessness. So about 22% of our evicted families have been homeless during pregnancy, compared to just 6% in the rest of our sample. So really big differences there. About 1.6% of our overall sample had lost a housing subsidy in the previous year, but 9% of our evicted families had lost a subsidy. So again, they're very high risk. And then we're seeing extremely high rates of hardship. About double the rest of the sample. 50% of our evicted families had household food insecurity, so again, struggling to provide enough food, and 25% reaching that really severe level of child food insecurity, compared to 26 and 12%. So given our prior research on food insecurity and the other research we've done in other areas, we're expecting that we're going to find extremely poor health and development outcomes in these kids. Here's some research, again, connecting to energy and the supportability question, the juggling that people do. There's a phenomenon called heat or eat. You can imagine what that is, that the cost of heating means that you're trading off and unable to buy other things like food. Obviously, that affects the quality of the housing and is tied to poor health. We've done a lot of work around energy and security and found that kids in those families are more likely to be hospitalized and needing poor health. Again, lots of healthcare cost implications there. And we actually did a study of scenarios about New York State. We were asked to do this. So we looked at seniors and young children, because those are very at-risk populations in energy world, and found that no matter the scenario, they had, if the costs increased, there were increased hospital, physician, and clinical care costs. And depending on how steep the rate of increase was, the increased costs were to the tune of $597 million to $2 billion a year. A lot of money, and very much related to cost of housing, cost of living. Now, just a brief about quality. It's a terrific piece that was supported by the MacArthur Foundation on housing quality. And probably many of you already know a lot of the research around housing quality is connected to asthma, to allergies, to injuries, to lead poisoning, all extremely important issues, not to discount them. But I think that this piece is really interesting because it looked at housing quality and its connection to mental health. and found that housing quality was the strongest predictor of emotional and behavioral health problems, and predicted very poor school performance. And this is a really interesting piece too, that they found that it was connected to the buffering relationship, so that the parent financial stress and depression from being in this poor quality housing was affecting their relationship with their kids, and the kids weren't being supported, and then that it was also making it difficult for them to form relationships with teachers and with pediatricians, which you stop and think about, it makes perfect sense. But then that makes you realize then they're losing out on that counsel, that support, that advice that could come from a teacher or from a pediatrician as well. So, why are we calling it a vaccine? Well, we're going to do a little public health 101 for a moment. Why do we vaccinate? Personal protection, that one's kind of obvious. Nobody wants mumps, rubella, measles. I hope not, anyway. And then this issue of herd immunity. I don't know if you've heard this term before, but I'm going to give you a quick tutorial. So the herd immunity, if you look at this top bar, you've got all these blue people that are unvaccinated and a few red little infected people, and they very quickly turn the majority of that group red. Most of these people become sick. The next bar down, you see a few little yellow vaccinated people, a few red people, and most people are still unvaccinated. They, again, very quickly turn that whole bar red, or most of it. But when you have lots of people in the community who are vaccinated and a few unvaccinated people, those few infected people can't really do very much harm. They can't really get to those people, and in fact, the vaccinated people protect the unvaccinated people. Because there are some people in our community who can't be vaccinated for various reasons. So that is what herd immunity is. And there are community and economic benefits to that. We've heard a lot about it recently. We had this 2015, or beginning of this year, this big measles outbreak in California that